The specialists at Central Florida Pain Management explain the challenges in diagnosing and treating fibromyalgia.
Fibromyalgia is a little bit more understood than it was 2 or 3 years ago, but still it's become, I think, a trash can where you put a lot of things that you don't know. Oh, you have fibromyalgia, so you'll calm down. We thought we had some therapies for it, like with Cymbalta or Lyrica or gabapentin, methadone. Still not working very well. It is no longer very fashionable, and the reason I think there's less and less people being diagnosed with fibromyalgia is because we're beginning to know other things that we called fibromyalgia, and now we know what they really are.
There's still a lot of people who don't think the fibromyalgia is real, and there's a lot of research now being done to try to add to the validity of it as a real disease. There's no test I can do for fibromyalgia. I can't send anybody for blood work. I can't do an imaging study to show whether or not they have it. All I can do is diagnose it based on a physical exam, which typically consists of certain pressure points in the body that are associated with pain. Patients who come in who are ultimately diagnosed with fibromyalgia typically have the same set of symptoms. They complain of overall aches and pains in their muscles, throughout their body, both in their upper body, their upper extremities, their shoulders, as well as in their lower body. Most of them complain of difficulty sleeping or problems with their sleep cycle, and there's almost always a component of history of depression or anxiety associated with it as well. Typically women. It's typically something that's diagnosed earlier in life, 30s and 40s. However, I do have some men that have fibromyalgia pain. There's more and more research coming out now on other types of factors that may predispose people to developing fibromyalgia earlier in life, and there's a lot of factors that now are saying that there might be a lot of emotional and psychological components or events that happen earlier in life that may trigger fibromyalgia when people get older. We'll learn more as time goes on here about it.
You'll find contact information for the village's location of Central Florida Pain Management when you click the Fibromyalgia Pain story link on our homepage at yourhometownhealth.com.